Low back pain usually starts with a little bit of niggling, a little bit of twitching in the back, and then it sends the message to your body that something is going on there. And your body reacts in the only way it knows to protect you from pain. So it starts to get into the stage where the body doesn't want you to move. So basically, it means that your muscles go into spasm, and that adds on another level of pain. It's more and more difficult. It's more and more difficult to move, to turn, to flex forward. And you start living in a vicious cycle of some problem going on in your lower back, but also the way the body tries to protect you from this pain in the lower back. And this vicious cycle is increasing your pain sensation, your pain suffering. And that's something what at some point, like any vicious circle, it simply has to be break at some point to stop the whole process. The symptoms of lower back problem will inevitably vary from patient to patient. It all depends how the whole process has been triggered. So, for example, the start of the back pain might happen when somebody flexes and tries to lift something very heavy and suddenly got the pain and cannot get back to the straight position. So this is a fairly acute event, and that would be usually associated with very severe pain. On the other hand, in many cases, it will be something developing over a long time, even years, with very occasional, every now and then, a little bit of niggling, a little bit of pain, a little bit of discomfort, which will go away when we sit down, when we stretch, when we take a hot bath. So the variety of symptoms and the intensity of symptoms is incredibly broad. The most important thing is to pick up those patients where the lower back pain is associated with some serious problem, like, for example, malignancy, like, for example, tumors, not necessarily localized in the back. They can be localized in kidneys and other structures around. So this is very important to pick up those patients and send them for immediate treatment. The other issue is the pain which is associated with neurological problems. So it's not only pain, but also numbness in the lower limb, shooting pain down the leg, pins and needles. Some people describe it as a little water trickling under the skin down the leg. So there are various neurological symptoms, and of course their severity will vary as well. Some of them will need immediate surgical attention. Some of them can be treated conservatively along with the pain. It's very difficult initially to say whether the pain is serious or not. Obviously, if the pain persists, if the pain gets worse, this is definitely the signal where the patient should seek some medical attention. And obviously, the pain associated with severe neurological problems is the immediate signal that the medical attention is required, probably the scan, probably the examination, etc., etc. One of the best examples is what is called the cauda equina syndrome. This is when some structure is pressing on the nerves running in the lowest part of the lumbar spine. Those nerves running there, they go to the lower part of our body. And any compromise of these nerves can affect not only the limbs, but also the bladder, but also the other structures. So these people can suddenly become incontinent. These people can get neurological problems, and that requires immediate surgical attention, because the only treatment for this condition is surgery when the obstacle or the barrier is removed and the nerves have a chance to go back to normal. If this is not addressed immediately, the damage may be permanent. So this is definitely something what is very serious, and we always say to patient, if this happens, please go to A&E and don't wait. Sometimes patients need an urgent surgical intervention, but also there are sort of elective procedures, elective operations where patients sometimes might be asked to consider. One of them is spine fusion. This is the operation when surgeons put the screws and sort of fuse the two segments of the spine so they can't move. It obviously helps with certain issues, but unfortunately, it immediately produces several other issues. So this is not something which should be taken lightly, and in my humble opinion, patients should have an opportunity to discuss and choose the other treatment options, non-surgical options, before they venture on this route. As I always keep saying to my patients, there's nothing wrong with surgery if this is what you want, but the most important thing to remember is that once you get your surgery done, you can't reverse it. Okay, so this is something what happened, and you can't say, oops, sorry, I don't want it. No, it did happen, and we have to appreciate that every surgery interfere with anatomy, interferes with function. So some of the interference will be temporary, but most of it will be permanent. So it might make future treatments, non-invasive treatment, non-surgical treatment, much more difficult. I would like to bring your attention to relatively new field in interventional pain management, which is the regenerative orthopedics. This is a very attractive opportunity and attractive option to have the spine problems, and not only spine but also joints problem, addressed and managed. The beauty of regenerative medicine is that it basically uses your own blood or your own stem cells. It doesn't involve any medication, any drugs, any artificial foreign bodies implanted into your spine. And also, I think that regenerative orthopedics offers a paradigm shift in the spine pain management. And I mean by that, that in the past, our possibilities were very limited. They were basically reduced to injecting steroids, to stopping the transmission through the nerves, but we didn't actually address the actual problem, the source of the problem. It is very easy and tempting option just to block the nerves and stop the painful transmission, but it doesn't stop the whole process which is going on in the spine or in the surrounding structures. So regenerative orthopedics can address those issues. We can treat not only facet joints, not only discs, not only nerves, but also we treat muscles, ligaments, so all these structures which are usually completely forgotten, but they are absolutely vital to maintain the stability of the spine and to improve function. And I think this is the main difference between so-called, or as I call it, traditional pain management and regenerative orthopedics. It addresses function, and it focuses on function rather than one source of pain, and that's it. So I think regenerative orthopedic should be placed somewhere on the treatment algorithm pretty high, definitely before surgery. Every patient who would consider the fusion surgery, the disc surgery, should have a chance to take a flavor of regenerative orthopedics, to have a discussion about regenerative orthopedics, and then decide. If I was to give just one advice to people with low back pain, I would say stay as active as you can. This is absolutely the most important thing, because if your activity goes down to sitting on the sofa with remote control, that will make your low back pain worse over time, because you will stop using your muscles, you will get stiffer. And although people are scared to move because they think and they believe, and I don't blame them, that's absolutely normal human reaction. They are worried that each movement can make it worse and they can end up on the wheelchair and so on. In majority of cases, 99% of cases, this is not true. And what I would recommend is seek an advice from the professional and get the treatment which can allow you to move, which will improve function. And then again, I will mention the regenerative medicine, and then keep moving and keep going, and you will get better.